Hello, I'm Aniku, a gynecologist. Welcome to Women's Health and Fertility, where we discuss important topics about women's reproductive health. If you have irregular periods, unexplained weight gain, acne, excess facial hair, or you've been trying to get pregnant and nothing is happening, there is one condition that may be silently affecting your body: Polycystic Ovary Syndrome, commonly referred to as PCOS. And the truth is, many women live with PCOS for years without knowing it. Some are told it's just stress, just lose weight, your periods will sort themselves out, you're too young to worry. But PCOS is real, it is common, and if left unaddressed, it can affect your periods, your hormones, your fertility, your weight, your confidence, and even your long-term health. So in today's video, I'm going to explain PCOS simply and clearly: what it is, the symptoms, how it is diagnosed, how it affects fertility, the long-term risks, and the biggest myths women are told about its treatment. So if you have ever wondered, why are my periods so irregular? Why am I gaining weight so easily? Or why is pregnancy taking so long? Then this video is for you. What is PCOS? Let's start with the basics. PCOS stands for Polycystic Ovary Syndrome. It is a hormonal condition that affects many women of reproductive age. Now, despite the name, PCOS is not just about cysts on the ovaries. That is one of the biggest misunderstandings. PCOS is really a condition involving hormonal imbalance, irregular ovulation, and often insulin resistance. This can affect the way your ovaries work and can interfere with your menstrual cycle, fertility, and metabolism. So if your body feels off but no one has explained why, PCOS may be part of the picture. Common symptoms of PCOS. Now let's talk about the symptoms, because this is where many women first notice something is wrong. 1. Irregular periods. This is one of the most common signs. You may have periods that come very late, skipped periods, very few periods in a year, unpredictable bleeding. Why does this happen? Because in PCOS, many women do not ovulate regularly. And if ovulation is not happening properly, your cycle becomes irregular. 2. Weight gain or difficulty losing weight. Many women with PCOS say, "I'm trying, but the weight just won't move." And that frustration is real. PCOS is often linked to insulin resistance, which means the body does not handle sugar effectively. That can contribute to weight gain, increased hunger, difficulty losing weight, fat accumulation around the abdomen. So it is not always laziness, lack of discipline, or eating too much. Sometimes the hormones are working against you. 3. Acne and oily skin. PCOS can cause increased levels of male-type hormones called androgens. These hormones can lead to persistent acne, oily skin breakouts that continue into adulthood, especially around the jawline, chin, lower face. If you are no longer a teenager, but your acne is still acting like one, hormones may be involved. 4. Excess facial or body hair. This is another common symptom. Some women notice hair on the chin, upper lip, chest, and lower abdomen. This can be distressing and can affect self-esteem deeply. And unfortunately, many women suffer in silence because they feel embarrassed. 5. Hair thinning or hair loss. At the same time, some women with PCOS notice the opposite on the scalp. For example, thinning hair, widening hair part, and increased shedding. Again, this is linked to hormonal imbalance. How is PCOS diagnosed? Now let's answer an important question. How do doctors know it's PCOS? PCOS is not diagnosed by one symptom alone and not by one blood test alone. Usually, we look at a combination of things. A woman may be diagnosed with PCOS if she has some of the following. 1. Irregular or absent ovulation. This often shows up as irregular periods. 2. Signs of high androgens. This may include acne, facial hair, hair loss, or blood tests showing elevated androgen levels. 3. Ovaries that look polycystic on ultrasound. This means the ovaries may show multiple small follicles. But here is something very important. You can have PCOS even if your ultrasound is normal, and you can have polycystic looking ovaries without actually having PCOS. That is why diagnosis should always be done properly and clinically, not by guessing from one scan. Doctors may also request blood tests to rule out other causes such as thyroid disease, high prolactin, other hormonal disorders. How does PCOS affect fertility? Now let's talk about one of the most painful parts of PCOS for many women, and that is difficulty getting pregnant. PCOS is one of the most common causes of ovulation-related infertility, and the reason is simple. If you are not ovulating regularly, it becomes harder to get pregnant. Because pregnancy requires a healthy egg released at the right time so sperm can fertilize it. If ovulation is delayed, inconsistent, or absent, conception becomes more difficult. That is why some women with PCOS may go months without ovulating, have irregular fertile windows, struggle to time intercourse correctly, feel like they are trying but getting nowhere, and that can be emotionally exhausting. But I want to say this clearly, PCOS does not mean you can never get pregnant. Let me repeat that. PCOS is not the end of fertility. Many women with PCOS do conceive, naturally or with treatment. The key is understanding what is happening and getting the right support. Now here is the part many women are never told. PCOS is not just about periods and pregnancy. If unmanaged, it can also affect long-term health. Some long-term risks include 1. Difficulty with blood sugar control. Because of insulin resistance, some women are at higher risk of developing pre-diabetic state, and some end up getting type 2 diabetes. 2. Weight-related complications, especially if metabolic health is affected. 3. High blood pressure and cardiovascular risk. Hormonal and metabolic changes can increase future health concerns. 4. Endometrial problems. If periods are very infrequent, the lining of the womb may build up for too long without regular shedding. That can increase the risk of endometrial hyperplasia and in some cases, over time, more serious complications. So PCOS is not something to just ignore because you're still young. It deserves proper attention. Now let's talk about some myths because this is where many women are misled. Myth 1. Just lose weight and everything will disappear. Weight management can absolutely help with PCOS, but saying just lose weight as if it's simple is not helpful medicine, because PCOS itself can make weight loss much harder. Women need proper explanation, realistic support, structured care, not blame. Myth 2. You can't get pregnant if you have PCOS. That is false actually. Many women with PCOS do get pregnant. Some conceive naturally, others may need support with ovulation tracking, medications, fertility treatment. But PCOS is not a life sentence of infertility. Myth 3. You only have PCOS if you have ovarian cysts. Also false. PCOS is much more than what an ultrasound shows. It is a hormonal and metabolic syndrome, not just a scan finding. Myth 4. Irregular periods are normal for everyone. This is not correct. Occasionally, irregular periods can happen, yes. But if your periods are repeatedly absent, very delayed, unpredictable, that is something worth investigating. Your body may be trying to tell you something. Now let's talk about what can actually help. Treatment depends on your goals, because not every woman with PCOS needs the same approach. If your main concern is irregular periods, treatment may focus on regulating cycles, protecting the uterine lining, hormonal balance. If your main concern is fertility, treatment may focus on confirming ovulation, improving cycle timing, fertility support if needed. If your main concern is weight, acne, or excess hair, management may include lifestyle support, hormonal management, targeted symptom treatment. Lifestyle changes can help, including regular physical activity, healthy eating patterns, better stress reduction, and in some women, medical treatment may also be needed. The most important thing is this: PCOS should be managed based on your symptoms and your goals, not just a generic one-size-fits-all plan. When should you see a doctor? You should seek medical evaluation if you have irregular or absent periods, difficulty getting pregnant, unexplained weight gain, acne that won't settle, excess facial hair, thinning scalp hair, symptoms that have been dismissed repeatedly. Please don't normalize suffering just because it has become familiar. If your body is repeatedly sending signals, it deserves to be heard. If you suspect you may have PCOS, I want you to hear this. You are not imagining it. You are not overreacting, and you are not alone. PCOS is common, but being common does not mean it should be ignored. The good news is it can be recognized, it can be managed, and fertility is still very possible for many women. The earlier you understand it, the better you can protect your hormones, fertility, confidence, and long-term health. If this video has helped you understand PCOS better, please like this video, subscribe to the channel, and share it with another woman who may be silently struggling with irregular periods, weight gain, or delayed pregnancy. And tell me in the comments, what PCOS symptom do you wish more people understood? Thank you so much for watching. I'm Aniku, and this is Women's Health and Fertility. See you in the next video.